I was frightened to death. I, I was a nurse, and so the diagnosis of lung cancer was extremely frightening to me. I thought it was a terminal diagnosis.
Sure, lung cancer is a very, very common malignancy, and it is one of the more aggressive cancers, one of the faster growing malignancies.
When I was offered the option of stereotactic instead of surgery, I thought that was marvelous.
So she was a stage 1 initially and was treated with stereotactic body radiotherapy because she was not a candidate for surgery at that time. And that is a type of treatment where a very high dose of radiation is given to the mass, sparing most of the normal lung around it. So that was done with curative intent. But then sometime later, she suffered a relapse in her lymph nodes in the center of the chest, called the mediastinum. It is essentially the equivalent of if a person had presented with stage 3 disease, they would have lymph nodes in that area involved. And the best treatment for that is combination therapy with chemotherapy and radiation given simultaneously, what we call concurrent therapy.
It just seemed that Hollings has the reputation in their NCI affiliated, which is a very positive thing. So it wasn't a difficult decision, you know, and especially after meeting the staff there, meeting Dr. Silvestri and Dr. Sherman and Dr. Sherman, it was pretty easy, and I'm very thrilled with the decision we made.
Every day I see lung cancer patients. And I see the problems that occur in lung cancer patients, and I work with a team of docs that are just like that. They're all doing exclusively one disease.
I felt very confident that we've done everything that we could do, and that, you know, what would be would be. So the good news was wonderful, and when I went to Dr. Sherman's office, her nurse, who was wonderful, couldn't restrain herself, and Dr. Sherman was I could tell when she walked in the office that it was a good PET scan.
She has not had any further recurrences, so now we're following her, watching for recurrence because she's still at risk to recur.
At the beginning of this whole process, I didn't think a cure was absolutely possible. I had all the bad visions of surgery and ventilators and all sorts of terrible things. When I was offered the stereotactic and then the other treatments, and they were so successful, that was a miracle. And that was the change that was, a few years ago, you didn't have that option. It would have been, you had to have open surgery, and, you know, there were no other options. Certainly MUSC and Hollings had changed what was possible by offering these other treatments, and I'm thrilled to death that I was able to have them.